my name is Dr. Charlotte and I'm with Alpine Fit Physical Therapy in Boulder, Colorado. In this video, I'm going to be going over how to properly foam roll your back. So I like to use our foam roller as more of a trigger point release tool or a mobility tool when it comes to our low back and our thoracic spine. So what I mean by that, we're going to go over a little bit of mobility first. So especially for the thoracic spine, which is the spine kind of in between our shoulder blades and then down a little bit lower, is we can use this to work on our extension mobility, which we tend to get very stiff in. So if I'm here, tightening my core, hands behind my head, I'm gonna find a good spot on my thoracic spine. I'm gonna take a deep breath in, deep breath out, and relax over this foam roller to work on my thoracic spine extension. So you can roll it up a bit, same thing, deep breath in, deep breath out, working on the extension. We can also do this in our lumbar spine, but not as intense because our lumbar spine is also always in lordosis anyways, but it can feel good to kind of work the extension here as well. Using it as more of a trigger point release tool, instead of just rolling our whole back like this over and over again, which is how most people use the foam roller, we're going to be a lot more specific with it. So if you're more tender on one side, you're going to actually rotate more to that side. So if I want to target the right side of my back, I'm going to rotate a little bit more to my right to put more pressure on that paraspinal. If I want to isolate the left, I'm going to roll to the left a little bit. So rolling to my right, I'm going to kind of roll up and down my spine until I find a really good tender spot. And then once I find that, I'm going to actually hang out there for 45 seconds, which is going to simulate what we do here in clinic, which is called a trigger point release technique. So this is getting that muscle to really release, help it activate, get some blood flow back. Instead of using just the whole muscle to kind of roll over, I'm being a lot more targeted with my rolling. So again, find another tender spot, hang out there, use your body weight as a release, and holding that for about 30 to 45 seconds.